I want to talk to you today about gastritis and how it can relate to hiatal hernia syndrome. Gastritis is inflammation of the lining of your stomach. Now, gastritis is not necessarily associated with acid reflux, but they can occur simultaneously. So your stomach is a bag of acid, and that acid does not bother the lining, if you will, of your stomach because you have this nice mucus protective layer. So we have that throughout our gut, but the stomach is no different. And as long as that mucus layer is intact, then nothing is bothering the lining of the stomach. So in gastritis, that lining is inflamed, and it can be acutely inflamed, and that's something that you might have had once and it just resolved on its own. But what we're talking about today is chronic gastritis, and that is where the lining has been, inflamed for quite some time. You can have an erosive type of gastritis. That's one that causes stomach ulcers, or non-erosive. So you have the inflammation, but it's not causing ulcers. The symptoms associated with gastritis are nausea, vomiting, having kind of a gnawing, burning pain in your stomach, getting full easily. What am I forgetting? Oh, bloating, belching, so loss of appetite. A lot of similar symptoms that we see with hiatal hernia syndrome, but this is what we're going to talk about, is what are the distinctions and what are the commonalities. So when we look for root causes of gastritis, infection is chief amongst them, and something we're always testing for is an H. pylori, short for Helicobacter pylori infection, which you can get in your stomach that can cause gastritis. And that's something we never miss testing for when we're looking at overall gut health. It's part of our microbiome test, and there is a natural way to treat H. pylori. There's also a triple antibiotic therapy, which is a bit rough, but there is a natural way, and of course you test afterwards and make sure you've eradicated it. Alcohol consumption can be a problem, as can smoking. In addition to that is taking drugs. Now maybe you've heard about NSAIDs or ibuprofen being hard on your stomach. So these drugs are known to inflame the lining of the stomach, and that's where their danger can lie. So if you need pain relief, you want to steer away from those and find another alternative if you can. So the infections are something that are in common with hiatal hernia syndrome, because you get this overall inflammation of the gut, and that creates increased pressure, and the pressure pushes on the stomach. You get the elevation of the stomach and the diaphragm. That push and compression of the stomach starts widening that opening where your esophagus goes through your diaphragm. Both of them can elevate to the point where your heart starts palpitating. And so root causes are common for both of these problems and issues. What I wanted to talk about was an additional root cause of gastritis, which is stress. When people go into that fight or flight kind of overdrive and they can't relax. And this is a connection that hiatal hernia has, once again, because when the stomach compresses and elevates and pushes on the diaphragm spasms, meaning it's moving, but it's not freely moving the way it should, where breathing is effortless, and you can feel a tightness in your chest. You can sometimes feel like you have to take a deep breath. You've run a little bit low on air. And what that causes is that your nervous system goes into a fight or flight, because our nervous system is very attuned to how much oxygen we're getting. And of course it would be, because you don't live very long without oxygen. So your nervous system gets into this fight or flight, anxious stress mode, sending out basically alerts. It's kind of like why you have a smoke detector in your home, right? That obnoxious sound takes you out of sleep. It certainly will get your attention, and it's trying to say, do something because there's danger ahead. And that's exactly what these stress hormones being secreted are trying to convey as well, which is oxygen is not where it should be, do something. And you don't know that's what it's trying to say. You just feel anxious and stressed and can't relax, and that's that phenomena. But the connection between feeling stressed and getting further imbalance of your gut microbiome is that gut-brain connection is known. But what I'm trying to sort of fold in here is how hiatal hernia is often seen with gastritis and why that can be. Okay, what else did I want to look at? Oh, as far as treatment, basically it revolves around removing triggers, which, not just, and I should say the classic treatment for gastritis is here's your antacid. And again, much like acid reflux, it's not that your stomach is producing too much acid. In this case, with the gastritis, we're talking about the lining of the stomach. It's very different. So certainly, people can feel a little more comfortable on an antacid, but definitely check out some of my videos where I talk about all the dangers associated with antacids, because there are many. So instead of that route, what we want to say is, why do we have this inflammation? Where is it coming from? So I mentioned the infections. Certainly drinking excess alcohol is a known stressor. The stress that we just discussed, being a smoker. Also having autoimmune disease like Hashimoto's, type 1 diabetes. So you want to get these under control, not just from a drug therapy, but it really speaks to getting your immune system under control, because what can happen with gastritis is your immune system starts attacking those cells of the lining of your stomach, and the inflammation is coming from that. So here at Root Cause Medical Clinic, we do a lot with treating autoimmune diseases naturally by getting to the root cause. And it has so much to do with gut health, because 70% of your immune system is housed in your gut, so that only makes sense. You can have food sensitivities, you can have infections, the stress and hormonal imbalances. It's all kind of a checklist that we go down, and each program is developed for each individual. So it's a customized, personalized program, because 10 people could be standing next to me with gastritis, but they'd have their individualized reason of how they got there. So therefore, treatment has to be focused on that as well. I'm going to look at my notes, see if I forgot anything. That was it. That's what I wanted. That's what I wanted to share. So if you've had chronic gastritis for a while, we do want to take that nice holistic big picture of why. And the body loves to heal. It's very strong. It's very resilient. And we can assist with that if you want the help. So reach out to us. I hope you enjoyed this video. Give it a thumbs up so more people can see it. Subscribe to the channel, and we'll talk again soon.